Hello everyone, I'll be talking about the anatomy of lung, the bronchopulmonary tree and also the segments of the lung. As you all know that the lung is an important organ of respiration. It helps to oxygenate the blood by bringing the inspired air inside, and this inspired air, it will come in close relation with the venous blood in the pulmonary capillaries, and this is how carbon dioxide is exhaled out. Now, if you look at the healthy lung is pink in color, it is spongy and it has many cavities. Now, lungs, if we see the situation of the lungs, where are they situated? They are situated in they are situated just adjacent to the mediastinum in the thoracic cavity. Now, mediastinum is an area where there is presence of heart, there is presence of esophagus, thoracic duct. So, the pair of lungs, they are lying adjacent to it. Now we have bronchus. We have trachea. The trachea divides itself into bronchus. So trachea is present in the mediastinum, but bronchus is getting inside. But it will enter the lung. This how we have the pulmonary trunk. The pulmonary arteries, they are going to pulmonary trunk is lying in the mediastinum, but the arteries, they will enter the lung. So the area from where the all the structures are entering into the lung, that is known as the root of the lung. The lung is surrounded by a layer that is known as pleura. It is the serous layer. The pleura is further divided into two. We have the visceral pleura and the parietal pleura. Parietal pleura is the layer which is present on the outside, and the visceral layer is the layer which is just adherent to the viscera, that is lung. Between both the layers, the visceral layer and the parietal layer, we have a space that is known as pleural space. In this space, there is presence of pleural fluid. Now, as I was talking about the root of the lung, now this root of the lung, it is acting as a channel by which the bronchus is getting inside, the pulmonary artery is also getting inside, the bronchial arteries also enter from there. Then there are presence of superficial and superior and inferior pulmonary plexus, lymphatics. So they all are present at the root of the lung. Now, this root of the lung is enclosed by there is continuity of this the pleura, both the parietal and the visceral. So there is no space in between the parietal and the visceral layer where there is where there is root of lung. So these two layers, they are just adherent to each other and they form a pulmonary sleeve along the root of the lung. Then there is an area which is known as hilum of the lung. Hilum of the lung, it is also present on the medial surface of the lung, and this is that area which is forming the root of the lung, where the structures, they are leaving the lung and they are entering the lung. So this was just the few features about the lung. Now we'll be talking about the gross anatomy of the lung. See, once you see the lung, it has an apex, it has a base. It has two borders, anterior border and posterior border. It has three surfaces. It has a costal surface, it has mediastinal surface, and it has a diaphragmatic surface, which is also known as base. Now, if I talk about the borders, the anterior border of the right lung, if you see, it is straight, and the left lung, there is presence of a notch that is known as cardiac notch. Now, this cardiac notch is present because there is lying the apex of the heart. So that's why there is presence of a cardiac notch there. Then, if you look at the posterior border is little blunt, and it is all on the posterior aspect of the lung. Then apex of the lung is the superior most part of the lung, and this apex lies below the first rib, and it enters the root of the lung, root of the neck. Then we have the costal surface. Now this costal surface, the anterior surface, it is related to ribs, the costal cartilages. Then we have the intercostal muscles. So these are forming the relations of the costal surface. Then we have the diaphragmatic surface. The diaphragmatic surface is related to the diaphragm, because diaphragm is separating the thorax from the abdomen. Then we have the mediastinal surface. Mediastinal surface, all the contents of the mediastinum, which is lying in the center, they are coming in relation with the mediastinal surface. like we have arc of aorta, we have the SVC, then we have the brachiocephalic veins, then trachea, esophagus. So then a zygous system of veins, then we have the thoracic duct. So they all are forming the relations of the mediastinal surface of the lung. So the if see the both the lungs, once you see it grossly, they are divided into lobes also. The right lobe, the right lung has two lobes, the superior, middle, and inferior. So there are two fissures, the oblique fissure and the horizontal fissure, which are dividing the right and the left lungs into lobes. The right one has three lobes and the left one has two lobes, the superior and the inferior lobe. Now, so this how the gross anatomy of the lung goes. The surfaces, the borders, then the we have the apex, the base, and the what are the relations? What are the structures which are related to the surfaces? Then once you compare the right lung with the right lung is little heavier. It is heavy, and then it is little wider also, and it is little broader also. Why? Because of the presence of the right dome of the diaphragm that is pushing the lung a little upwards. That's why it is little wider also. Then once the trachea, it divides itself, so it will divide itself, and then this is known as bronchus. Now bronchus, it will divide itself into lobar bronchus. Then after that there are segmental bronchi. Then the further divisions of this bronchioles will occur. There is terminal, the tertiary, terminal, then comes the respiratory bronchiole, and after that there is alveolar ducts. After the ducts there are alveolar sacs. Now these alveolar sacs, they are lined by a squamous epithelia. They are just lying adjacent to the capillaries, where this exchange of the oxygen will take place. Now, so once we see the lung, now the lung is aerated by the segmental bronchus. Now, according to the division, we divide it into according to the division. They are now, the lung is divided into segments. Now, these segments are known as bronchopulmonary segments. Now, bronchopulmonary segments on both the lungs, there are around 10 segments in the right lung also, left lung also. Now, so as the so we name these bronchopulmonary segments. How do we name them? Like onto the right side, we have we have three lobes. The upper lobe will have three bronchopulmonary segments: the apical, anterior, posterior. Then the middle lobe is divided into medial and lateral. Then the lower part is divided into the superior. Then it is on the base, so anterior basal, lateral basal, posterior basal. Once you see it from the medial surface, then you have then there is medial basal also. Similarly, onto the left lung, we have the apical, anterior, posterior. Then there is lingula, so it's a tongue-shaped protrusion which is present on the anterior border. So we name it accordingly: superior lingular and inferior lingular. And the basal are all same. You have anterior, lateral, posterior, and medial basal. So these are the bronchopulmonary segments. Now these segments, they have their own blood supply. They all they are all supplied by your pulmonary arteries. But the venous drainage, see, there is connective tissue between the bronchial segments. Now the venous drainage is shared by two bronchial segments. So this is what is this is what I wanted to tell you about the anatomy of the lung, the bronchial tree, and the segments of the lung.